So what are the different types of glaucoma? There's open angle glaucoma, narrow angle glaucoma, congenital glaucoma, and several others. And by the end of this video, you'll know them all. So let's take a look. Hey everybody, welcome to Dr. Eye Health. I am Dr. Joseph Allen, and I'm here to help you learn everything about the eyes, vision, and vision products. So if you're new here, consider subscribing. And at any point throughout the video, make sure to check out the show notes and links below for further information about anything that we go over. Also, keep in mind this video is the second video in our playlist all about glaucoma. If you're new here, that's great, but don't miss out on all the other videos covering this important topic. If you'd like to catch those other videos and the whole playlist, I'll hook you up with a link in the description below. So now let's go over the different types of glaucoma. The first and number one most common type of glaucoma is called open angle glaucoma. And it's called that because of a structure of the eye that we call the angle is open. And that angle is described by the iris, the colored part of the eye, and the cornea, the clear window part of the eye. And they come together at kind of a junction. And in that junction, they have a structure called the trabecular meshwork, and then there's what's called the uveoscleral route, and that's how the fluid inside the eye drains out. But for some reason, and it's not completely understood, but proteins, pigment, causes this trabecular meshwork to get clogged up, kind of like the drain of a sink. And if it gets clogged up, the fluid can't drain properly and the pressure then rises. That puts excess pressure on the nerve in the back of the eye and causes that nerve to die off slowly, causing vision loss. So now that we've covered open angle glaucoma, which again is the most common, there's actually another type that's just the opposite, and we call that narrow angle glaucoma or angle closure glaucoma. And that's because the angle isn't open anymore, it's closed off. And that means the drain is completely closed. And so the eye pressure starts going really high. And in that sort of scenario, if someone has an angle closure attack where it completely closes off, then their eye actually becomes very painful. They'll have a red eye that's painful, really blurry, maybe tearing, and typically associated with nausea as well, and a really bad headache. You know, if you're experiencing all those symptoms, then you should pause this video and call your doctor immediately. It's actually considered a medical emergency. So call your doctor. If you can't get a hold of them, then call the closest clinic or hospital and get seen, because it's potentially a blinding condition. If you go see the doctor or someone comes into our clinic with this condition, we usually get a couple people a year. We dump a ton of different eye drops on the eye to start lowering that pressure, and then ultimately they'll need a surgery procedure, usually with a little laser, to help bring that pressure down to a safe level and keep it there so that they don't develop any other further vision loss. Now, both open angle and narrow angle glaucoma are both associated with elevated eye pressures, but not all forms of glaucoma have high eye pressures. In fact, there's one called normal tension glaucoma. And in this condition, the people still have optic nerve head damage and vision loss, even with low eye pressures. Now, it's really important to have a comprehensive eye exam when you're diagnosed with normal tension glaucoma, because there's many other risk factors that have to be kind of evaluated for, particularly blood pressure. And it's actually not high blood pressure, it's low blood pressure. It's believed that people with low blood pressure, especially at nighttime, whether that's naturally or from medication use, may actually cause this condition to progress. Despite any of these risk factors, the usual treatment for normal tension glaucoma, as well as regular open angle or angle closure, is still the same. We still decrease the eye pressure to safer levels. Now, the elderly, and actually anybody over the age of 60, is at a higher risk of developing glaucoma. It's just more likely. But there are times when people, even young individuals, can develop glaucoma, even children. In fact, some kids can be born with glaucoma, and we call that congenital glaucoma. And that's one of the reasons why it's so important for children to have an eye exam with an eye care professional within the first year of life, typically between the first 6 and 12 months of life. However, congenital glaucoma usually does present with some obvious symptoms. Usually it's excess tearing, a cloudy eye, and the eye actually can even look kind of blue and kind of larger than normal. And in most cases, when children are born with congenital glaucoma, it's something that can kind of be told really early on. Now, most of the other types of glaucomas that are out there are actually all grouped into what is called a secondary glaucoma. So the first ones that we talked about are all really primary glaucomas, meaning they just happen on their own. But then a secondary glaucoma is when it happens due to some other complication, usually to some other medical disease. Now, the most famous one that's very severe is called neovascular glaucoma. And this happens because of new little blood vessels that grow within the trabecular meshwork, in the angle, and they actually clog up the drain and cause the pressure to go really high. And again, this is a really severe form of glaucoma, very difficult to manage, and usually it comes as a result from uncontrolled diabetes and high blood pressure. Then there's other types of glaucomas that can develop either due to really severe forms of cataracts or even from tumors within the eye. You can even develop glaucoma from an inflammatory condition called uveitis. And if you've never heard of uveitis before, there's several different forms, but I have covered anterior uveitis. If you want to check out that video, I'll hook up a YouTube card in the description above, as well in the description here below. But beyond just inflammation from uveitis, you can even get it from inflammation from surgeries. You can have glaucoma after a surgery if something doesn't go right. You can even develop glaucoma from using steroid medications that we prescribe for things like surgeries or something like a uveitis. If someone's on a steroid too long, some people, and it's estimated around 10% of the normal population, will have a reaction to steroid medications where their eye pressure starts to go up really high. So whenever somebody's taking a steroid medication, especially for a long period of time, eye doctors will monitor eye pressure pretty closely. Now, there's actually two different types of secondary glaucomas that I find particularly interesting. One is called pigmentary glaucoma, and the other is called pseudo-exfoliation glaucoma. Pigmentary glaucoma is a special condition where the iris, the colored part of the eye, actually has chunks of the iris. This pigment gets shaved off throughout life, mainly when we're young. But this gets shaved off because of the presence of the iris and how it's next to the zonules or the suspensory ligaments of the lens. And so when the iris dilates and constricts when we're really young, the zonules rub against the pigment and the pigment gets released, and then it follows the aqueous humor and gets trapped in the trabecular meshwork, again, the drain of the eye. So with all this pigment trapped in the drain, the fluid can't rush out, and so the pressure goes up. Then we have the pseudo-exfoliation glaucoma, which again is probably my favorite because it runs in my family. Pseudo-exfoliation, it's called pseudo-exfoliation because there's another condition called true exfoliation. True exfoliation is actually something that glass blowers will get when they're not wearing eye protection due to exposure of infrared light. Now, a pseudo-exfoliation is when there's a protein inside the eye. It kind of looks like dandruff almost, but is a protein that builds up on inside of the eye over time, over your lifetime, and they don't know exactly what causes it, but they know it is genetically inherited. So anybody from a Northern European descent, particularly in Scandinavia, or really anybody from the Mediterranean sort of sea area, is at a higher risk of having this type of glaucoma. So this basically kind of it's almost like, again, dandruff-like material, this pseudo-exfoliative material inside of the eye gets released, gets kind of shaved off, and it gets trapped, again, in the same thing, in the trabecular meshwork, and the eye pressure then goes up. Now, just because somebody has pseudo-exfoliation syndrome doesn't necessarily mean they're going to get pseudo-exfoliation glaucoma, but it is somewhat likely at some point in their life. Now, again, a comprehensive eye exam can catch most types of glaucoma early on before vision loss. So please, if you haven't had your annual eye exam yet this year, go ahead and make an appointment to be seen. So, eye health question of the day. Does glaucoma run in your family? And if so, do you know what type they have? Go ahead and comment in the section below. I'd love to hear from you guys. All right, everybody, thanks so much for watching. Hey, why don't you do me a favor, hit the like button down below and subscribe if you're new to the channel, and share this video to anybody who you think might benefit from learning more about glaucoma. Otherwise, if you'd like to catch out other cool videos from Dr. Eye Health, just click or tap the screen just up here, or click or tap the screen down here. Otherwise, keep an eye on it, and we'll talk to you soon. A narrow angle oh, wow. My mouth is so dry. Oh, wow, I can't believe I did that whole thing without coughing. Oh.